USMLE style question, teratogen exposure week question. A 29-year-old woman comes to the clinic for a routine prenatal visit at 12 weeks gestation. She reports that before knowing she was pregnant, she took isotretinoin for acne and drank alcohol socially during the first trimester. She is concerned about potential effects on her baby. Which of the following best describes the risk of teratogen exposure during the embryonic period, weeks 3A? No significant risk since organogenesis is complete. Highest risk for structural malformations. Risk is limited to functional deficits, not structural defects. D. Only neural development is affected. The embryo is completely resistant to teratogens at this stage. Answer and explanation? Correct answer. B. Highest risk for structural malformations. Weeks 3 to 8, embryonic period, is the critical period of organogenesis, where the developing embryo is most susceptible to teratogens. Exposure during this period can lead to major structural birth defects, e.g. cardiac, limb, craniofacial, and neural tube defects. Why are the other options incorrect? A. No significant risk since organogenesis is complete. Incorrect. Organogenesis is not complete until after week 8. The embryonic period, weeks 3 to 8, is when organs are forming, making this the highest risk time for malformations. C. Risk is limited to functional deficits, not structural defects. Incorrect. Functional deficits, e.g. cognitive impairment, occur later, weeks 9+, fetal period, but structural defects are a primary risk during weeks 3 to 8. D. Only neural development is affected. Incorrect. Neural tube closure occurs by week 4, but teratogens during weeks 3 to 8 can also cause cardiac, limb, and craniofacial defects. E. The embryo is completely resistant to teratogens at this stage. Incorrect. The embryonic period, weeks 3 to 8, is the most vulnerable. However, before week 3, teratogen exposure often follows an all or none effect, either causing miscarriage or no harm. Key learning points. Weeks 3 to 8, embryonic period, highest risk for structural malformations. Weeks 9+, fetal period, more functional deficits, e.g. cognitive issues. Common teratogens and effects: isotretinoin, craniofacial, cardiac, CNS defects. Alcohol, fetal alcohol syndrome, facial abnormalities, microcephaly, intellectual disability. Thalidomide limb defects, phocomelia, valproate neural tube defects, warfarin nasal hypoplasia, stippled epiphyses. Would you like another teratogen-related question? Maybe focused on